Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the Wellness Dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast. I'm your host, Dr. Katie Toe, and we live from Beyond Biohacking in Austin, Texas. Today, I have a special guest that already on the show, but she's here at the Biohacking Conference, so we got to have her back because we are the very few biological wellness dentists at the conference. Right. And so we have a lot to talk about, lots of update. And so welcome back, Dr. Ratna Indah.
Thank you. Thank you, Katie. So very exciting to be here. And like you said, we are some of the few dentists who make it here. Mm-hmm. And I think it's really important that we are here. We get to see how we've been here a couple of times, a couple of years. And I think this is the first time we start seeing the presence of the oral conversation. And we're talking about health, and yet the mouth has been separated from the rest of it. Yeah. I think it was really exciting. You get to hold the first room here at Beyond Biohacking as a dental room. And that was a packed room because everybody had questions about the mouth. And
everybody was shocked.
Yes.
Yeah, when we're asking them to raise their hand, who had their wisdom teeth extracted, almost the full room, who had root canals in their mouth, majority of them, who have metal or amalgam filling.
Oh, those pictures that you have about how the mold was growing underneath people's crowns. I think that was, a lot of hands or eyes really got popped out whenever they saw that.
Yeah.
So that was
because
amazing.
They would try biohack for better sleep, better supplement, and so many things that they're doing, so many technologies, and probably a long routine morning and night.
Right.
But they forget the mouth is an upstreams and it's been dumping all this toxicity and inflammation to the system.
So I think it's the fact that people will spend 5-figure on biohacking, on health tracking. They're testing their saliva, they're testing their adrenal blood work, but nobody's testing about the mouth bacteria or the oral inflammation that they have. And when it goes untracked, that's when it wreaks havoc on the rest of the system. It's kind of go downstream.
Yeah. So. And most of the time it's silently and it's painless. And that's the reason why if you're having pain somewhere else, you're like, I need to figure this out. This is driving me crazy. Even the migraine, people are like, I need to figure this out. However, with like an infection in the jaw, we know it's possible been there for years or decades, but it's silent and it's painless. And so people don't really know what to look for. And in fact, I just had Dr. Jess on here not too long ago, a couple hours, that her patients would not know. And would, she's making an effort to put the questions on her form. But the fact that people have no idea that was even to look there, because medical school did not teach them anything.
And I think that's the sad part.
Dentistry.
It is more of an academic disassociation. It's more of a system separation. It wasn't that 100 years ago, suddenly the mouth gets separated from the body, but the system to evaluate it, the system to see what the impact has got separated. And I think it's time. I want to say dentistry is the next frontier in biohacking, because I think more and more people becomes more aware of the inflammation that is in the mouth and has been able to reach out. And we have more research, and research not just from the dentistry part, but research from the medical side, which makes a difference because, we're a wet finger clinician. We don't necessarily have the time to run a double-blind study. The medical side does.
And they track everything.
Yes. And I think even they have been surprised finding all these organisms in people's brain, in people's breasts, in areas and heart. Yes. Yeah, you're right. That's definitely the longest one. I think we've had over 2 decades of study on that one, right? And
yeah. And no one really arguing about it. They all know the connection and the danger. However, the action is not enough in preventions and interventions, especially with patients that have, say, heart history, run in the family or risk, because everyone have stress in these days, right? And all of that, they ignore the factor that, hey, the mouth is bin and hidden infections and burden to the system. And I think today a lot of functional medicine doctors actually start asking questions, and we see more and more of that connections and tracking. And I think that's a great news, but we need more people doing that.
And I think in dentistry, we do ourselves a disservice when we just tell our patient, hey, go get your deep cleaning, go get your SRP because it's related to your heart health. But what?
Yes.
Like we already know the name of the organism. So if we are more specific as dentists saying, P. gingivalis
so good.
have been actually shown. And then we talk about the mechanism of the actual rupture that happened with the inflammation. And that becomes a story that people can relate to rather than like you telling them, well, your insurance doesn't cover this, but you should get a deep cleaning. There's no connection. It doesn't become personal. So I think that conversation, we as dentists definitely have room to become part of the solution of like, this is the specific organism and this is the mechanism and this is how we're going to be able to help you. There's so much room that we can do there for the greater good. So.
Yeah. And that's why when you're having a phase contrast microscope in your practice and people can see the pathogen in the saliva on the screen, and they're like, that's not my mouth, right? No, that's your mouth. That's the parasite that's swimming in there, and that's the pathogen. The bacteria, right? So for me, when people don't see it, there's no connection. When people don't know the why, there's no action. Like funny story, I know you know my mom, and she was scheduled for a surgery, and the doctor was like, "You cannot eat. You have to fast," but not telling her why she had to fast for the surgery. And of course, her surgery would delay from 9 to 1 p.m.
Oh, no.
And she was hungry.
Yeah.
And so by the time it's her turn, they're asking her, like, did you eat anything? Did you fast? And she said, yes. It's like, are you sure? Because you can die on the table if you ate something. And she said, yeah, I ate. So when people know that you can have complication and actually will cost you your life, then I guarantee you, if she know that information the day before or before the surgery, she won't do it. But because they just tell her, okay, fast, and doesn't tell her why, what happened, what the consequences that you said about the heart condition.
Right.
That's why she's like, I don't think it's going to hurt because I just have a bite or a little bit of sip or something. So I think that when a provider assume, because we know so much, and we assume the patient would understand, oh, you know what, if you don't treat the gum disease, it's going to go into the heart, go through the blood vessel and deposit the plaque in the heart or the brain, and that's what's causing it, then I think they will think twice about not flossing tonight or not brushing.
I think clarity gives people motivation, because the clarity, then you have a vision. You, as the provider and educator, you can kind of guide your patients. We're going to arrive here, and this is how we're going to help you get there. And without that clarity, like your mom, she's like, well, I'll just sneak in a little bit of lunch.
It doesn't hurt, right? It's just tiny bit. Like, how's that dangerous can be? Yeah. And I think patients think like that. Oh, wait, you know what? I feel really tired today. Like yesterday, a lot of people party, right? Late at night. And they'll be like, yeah, if not, I'm not brushing for one night. It's not gonna kill me. Right. We don't know that. Right. So we need to make sure that we understand the connections and therefore it gets to the motivation and the action. Yes. And I love that, you'll be able to show that to your patient every time they come in, that, we can see what in your mouth, even though you have no bleeding, no pain. You think you brush really good with electric toothbrush and you water pick and you floss, but look at the pathogen in your mouth.
And I think because the research, we talked about how we've already known for 2 decades already, very strong research on how oral bacteria affects cardiovascular health. One of the things that has drive me nuts a little bit, but I understand where it's coming from, is I have directly and indirectly heard cardiologists telling their patients, don't floss. These are hard patients and, people that have had MI, have had heart attack. And then I've had a patient that come to me, well, I'm not supposed to floss. My cardiologist told me don't floss. And I've actually heard it directly from a cardiologist we both know who has said that in public. And it frustrates me because the study is there and the cardiologists are very smart specialists who does very, very important work, right? Like, it's not heart surgery. I mean, there's a reason why it becomes a phrase. But unfortunately, I think it's because of the system, the silos in medicine. So their advice makes sense in terms of, okay, some of these people who are very high risk when they floss, they might be introducing bacteria, which leads to endocarditis. But when you look into the big picture, we're talking about P. gingivalis, the same organism that we already know affect Alzheimer. The science is, I think, is pretty mature on that one.
Yes.
Tons of research
There's
on
no
that.
argument. Yes.
Yeah, there's no argument on that.
Yeah.
So if you don't floss, you're going to have this organism that continue to grow. And now the patient's going to have so much that affects both their brain and their memory that the only thing safe is don't swallow your saliva. And I mean, that's not possible. But I think that's
we
what
swallow
I'm saying.
saliva every 30 seconds when we're awake and every minute when we're asleep. We never not swallow our saliva.
Right. So it's meant well, but because of the silos of how the systems are, it's not connected. It's a shame that dentistry hasn't been part in the room when medicine's talking, I feel, when we're addressing. And who gets hurt? The patient.
The patient.
So.
Yep. We just talked to Jim Quick about that, and he said, why doesn't have more?
Guy. Oh my gosh.
Yeah, why
how
don't we have
exciting.
more biological dentists or wellness dentists? And I said, is because we're not communicating, and there's a sick care versus health care, and the person that got hurt is the patient.
Yes.
And so that's a reality. And when a third party interfere with the care, the patient let go of the ownership, and the provider get limited an option, who's get hurt? The patients. So I know you're very passionate about access to care and, you know, all the possibility that the patient can do for themselves,
Yes.
you know, not just within the system, but obviously they have to take the ownerships of who in charge of my health, me,
Yes.
and who am I working with to help me to get there, the right provider, the right healer.
So I think we discussed it before. My background, I came from journalism, which is not usually your major before dental school.
Not many dentists I know that's the major. Most of them are biology.
So
Right.
there's quite a bit of study about language, word choice, and how it shapes people's choice. You know, a good example is pre-owned car. You know, you can just say it's the used car, and it just doesn't have the ring of like certified pre-owned. There's actually a study that shows the sales of used car increase, and there's more trust in it when they change the name from used to certified pre-owned. So in my office, because you were talking about system, about people making decision, I have tried, and I'm still working on it because it's kind of ingrained in my team, to ban the word dental insurance. Because it's
Thank you.
not...
Thank you.
I think you get where I'm going with
Yes.
this, because it's not a true insurance. When you think of medical insurance, it's something that protect you from catastrophic loss. Okay, you have brain tumor, it's going to get surgery. If you talk about car insurance, you're going to get protected from, again, a catastrophic thing.
Total loss, yes.
Yes. Dental benefits is a specific pot of money. And I think even in certain states, you can see the language legally, it's not called insurance. They have to file under benefits because it is a certified benefits, you know, like a limited benefits. I think even the ADA language is dental benefits. But when you say insurance, there's inherently the sense that it's going to protect you. Do you really want to go against the word insurance? So doctors, don't call it dental insurance. It's a dental benefits. And you do your patients a disservice because when they get a letter that says your SRP isn't covered, you create the mistrust, not you create, but like there's a mistrust in the patient. Well, my insurance that's supposed to protect me is telling me it's not covered. Is my doctor? Can I really trust my doctor? And again, who is at the disbenefit here? You know, we're like the patient lose again. They're not getting what they need. So I think the word dental insurance should just be gone. Every office, we should stop marketing the word insurance because it's really a limited benefits.
Misleading.
Very misleading.
Yeah.
So,
and if we take the ownership and say we stop calling it dental insurance and start calling it what it is, which is dental benefit.
Yes.
And the benefit, you use it or you lose it, or the benefit have either a little or a little bit more, you still have to put in your effort and your investment.
Yes.
And so I think that a lot of patients really delegate their ownership to doctors, to dentists, we've seen that,
Yes.
and to insurance company. And then when they turn around and have a lot of problem, they realize that the insurance are not for them. $1,500 a year, right? Not keeping up with inflation, which is if they keep up with inflation, I think we should have about what, $30,000.
Is that what it is?
It
Because it
is,
was
yep.
the same number from 70s. So
Right.
what costs
so-
$1,500 in the 70s
Yeah,
must cost 30.
gas is not 20 cents, right? So we're definitely seeing that the misleading that creating, just like you said, a trust issue between providers and the patient. but it's also delegate that ownership. So patient doesn't think that they have to do any research or understanding why do they need this procedure or why they don't need that procedure. And they end up hand that ownership to the insurance company to decide what they can do or what they cannot do. So whenever we talk to the patient, we always want to empower them and said, this is the partnership. And you have 80% power to changing this trajectory of wellness. We, the guy, and we can do as much as we can, but it's only going to have to take 20% to change this. So you have the power to do that. And I think when dentists put it that way, patient come to realization that it's not just picking the best dentist or the best doctor, but it's also taking the ownership. And I think that's a big part that you always talk to all your patients about ownership.
Right. Actually, one of the great metaphor, you taught me this a couple of years ago, and you said, like the patient is the hero. It's really their journey, and we're really the guide. And I try to be the best guide I can be, and at the same time understand that different people are going to take different decisions just because where they are in life, and we have to respect that. And I think early on in my career, it feels really overwhelming of like, oh, they have to take this decision because this is the best option. But it might not be, because you don't know their life. You don't know their genetic. You don't know what they face. Maybe there's a reason why that patient was slightly more worried about antibiotics that dentists might want to prescribe for certain infection because they have had certain medical condition that arise from previous antibiotics. So we really don't know. So I think the respect of, hey, you need to be your own hero. You need to do your research. It's definitely.
And patient also asked me on social, how do I know if my dentists are the good one? And I'm always asking them what they learned lately, right? Because we hear every year, and every year we learn new things.
True.
And first of all, of course, we learn it so we can apply it to our life and to our health and our family. But then we bring it into our practice.
Yes.
And we said, this worked for us. We love this. And we want you to try. We want you to see how it worked for you.
That is so true, because my personal story, how I got into this journey, is my mom started losing her memory 8 years ago. So she's the first accidental biohacker.
Also a dentist.
She's also a dentist. So she does have some medical background. So she started doing protocols or looking at, and I had the privilege of a front row seat of seeing her figure things out and seeing it work. We were able to reverse it, and it was a pretty fast memory loss. She started being we live in Indonesia. I grew up in Indonesia, and that's where she still lives. She forgot how to speak English. She forgot the name of the assistant that were with her for close to a decade. So it was a pretty rapid trajectory toward memory loss. I ended up selling my office to a group because thinking I would have to go home to take care of her. But, and this is the clinician in her, she didn't just take it down. She didn't take it lying down. She did her research. And like I said, that's why it's accidental biohacker, really through necessity and maybe some desperation. And one of the things that was interesting was her use of, she was sleeping with some light. So light that was going through. So it was basically lower level laser therapy that was going straight into her brain. So kind of reducing inflammation there. And I would roll my eyes. I was like, oh, Mom, that's, what are you doing? But she would tell me things about how she felt more refreshed when she wakes up. And that's when I start looking into lights or lasers, like, oh, there are things that we can do that we don't think about it. Now, obviously, we understand lower laser level therapy. We use it for, our diode has that ability. Obviously, if you have erbium or other modality on lights, even more. But that was my journey kind of starting in this whole kind of biohacking. It was my mom. I don't even think she would ever call herself biohacker, but being able to reverse your memory loss, especially as bad as she was, I'm really blessed.
Yeah.
So.
No, I love it. I met her. She went to the course.
She did.
And at her age, who most of dentists are already ready to retire, she still travel across the continent, all the way from Indonesia to come to the U.S. to take a hands-on clinical course.
Right.
It's amazing. It was a really special moment to have both you and your mom in the workshop. I love that. And you just mentioned something that it came to me, that when people going through this healing journey, they want quick, fast, easy result, right? And healing take time. Even with your mom case, right? Even though she successfully, regained her memory, but it take times. It take a lot of time.
Right.
And that's my conversation with a lot of patients is that, yes, you will get better if you are consistent with this. there's no one trick wonder.
Yeah.
We wish, right? People would line up all the way, to the highway from this hotel. If someone figured out that one thing and say, you just take this magic pill, this is not Matrix, right? So for me, a lot of time patients want just a quick, if I'm taking this infection out, am I going to regain all this cognitive decline? And the answer is yes. And you got to consistently working on your sleep, your nutrition, your hydration, all of the things that you need to work on. Like Jim Quick went over 10 things for the brain. That's overwhelming.
Yes.
Right?
But it's,
and then no one can do all 10 perfectly. No. Not even us. And so even for us, it's take time.
Exactly.
And so I think that's a great reminder from your mom's story. Is like healing take time. And
it did.
People try to rush through the process. And in the end, they didn't get to where they want to go because they rush and they give up.
And I think if you know that it's going to take time, it would give people more that resilience of continue going even when it's not 100%. And I think that was another mentality I have to switch from being a dentist, because a margin is either perfect or it's open. The lab will call you. It's like, oh, doc, we can't read your margin, reimpress. So it's almost like 100% have to be there. But healing or health, it's a gradation. You have some improvement. And the reality is sometimes you can't improve completely. And any of us who take CBCT and treat TMJ knows you might be able to take care of the symptoms, but the shape of the condyle isn't going to be what it was when this patient was 17 before they flatten it or create concavities and cysts in it. And it's just not 100% sometimes, but it's an improvement. And it's a quality of life question.
It's a quality of life. Yeah. You don't have to be perfect. I don't think the biohacker here was like anyone there, even the one that you'd be like, wow, that's amazing number. That's amazing stats. But they're still working on it, right? And that's why I think Dave changed it to Beyond Biohacking. It's like, okay, it's not just a physical body anymore. It's your consciousness. It's your purpose.
Right.
And I love like all the presentation here talking about the meaning of life, the purpose, and how to be fully present. I think it's really beautifully curated because people are too obsessed with the physical.
Right.
And then indirectly create stress in their life. And I know how stressful it is to create a new practice.
Oh, yes.
You mentioned you saw because you thought that you had to go back to Indonesia, take care of your mom. And then you realized that that group practice setting was not for you.
Right.
Because your vision is different. So share with us that vision. The big one. Don't be, humble and say, oh, yeah, this is what I'm doing. I know your big vision. So you have to share with the dentists that listen to the show right now and the patients.
Well, the group practice couldn't work anymore because as I changed, the vision changed. The realization that dentistry, I mentioned about the next frontier, I really felt like we are the last frontier. When we know there's so many organisms that live in our mouth that could give hint into what's coming up, because it is a predictor of how healthy the system is. It makes sense that we start having health or dental centers that start tracking people longitudinally. So you continue measuring and then you see what happened to the organism. And I don't think it's we're addressing calculus. And I'm not saying it's wrong. I'm just saying that's where we were. And it's time that we can rise to the next level, right? Just like the field of medicine has changed, the way you would treat cardiovascular have changed. The way that you would treat cancer has changed. And I think the way we approach health in dentistry could also evolve because we know so much. Like I said, we don't have to do the research. Actually, the functional medicine side has given so much. But I think in the future, when we can see what we are able to do, we're talking now about genetic editing and protein where people can grow teeth. And I'm pretty sure it's actually coming. I might be a little extreme in saying that, but I think it's coming. I don't think it's going to be 10 years. So I am in that generation. I've been practicing, 20 something years now. I'm in that generation of being able to see in the beginning of so much change, like implant, now ceramic implant. And I think peptide is coming up. For an example, for women, we can see women as we age, we start having recession because of that balance between estrogen and progesterone is changing. We don't really have too much conversation in the oral space, I think, how to help women with that. We talk about the biologics, we talk about the connective tissue grafting. But the more and more health centers or dental centers thinking about that directions, I think there would be more advancement in protocol and even use of peptides that can help our patient. I know I spoke to somebody who has tons of research recently about the oral condition. He's a periodontist surgeon. And then he's like, oh, haven't even thought about that. And I'm like, well, as a woman who's going through, a certain age, that's something I think about because I get to see that in my patient.
Yeah.
So the vision is basically dental center as being part again of the conversation of medicine where we contribute and even help medicine not to reach certain stage.
Yeah. And I think that is something that a lot of medical doctors was looking for to send patient to. Because I talked to so many medical doctors and they said, I really know how important the mouth is as a part of the whole body, but I cannot find any dentist understand what I'm looking for. Give me a full evaluation and also give me a report and feedback on that patient. And so the fact that you said, no, this group practice is not for me. I'm going to go open a practice from scratch and build this practice and expand it to make sure that I can serve more patients. And I know you document the process.
Yes.
Yes, because it is a very difficult, I would say, complex and not a simple process because people who build a practice know it's not just construction. It's also patients, logistic team.
Yes.
Building a team that who support your visions and who understand the why behind it. Because a lot of team member, yes, to them it's a job, but if turning that job into a purpose and a calling is the job that the leader. They have to believe in your vision. And I know your team do believe in your visions, which is why I know that this model, especially what you're building in California, is going to be really big.
Thank you. It was a mind shift on some of the team members, especially those who have had extensive background in dental because they've seen a model of a practice. And then to say, hey, we're going to have this conversation. Why? Why are we talking about sleep? Why are you checking about airway? Why are we talking about, for an example, elderly women when they come in with darker teeth? I usually ask, have you had any bone scan? Because then immediately my thought isn't that, oh, they need bleaching, which they still will because they do still want to look pretty in their pictures. But maybe the reason why the teeth are darkening is because minerals not getting into it. And if the minerals not getting into teeth, you're not sure that it's getting into the bone either. It's a bigger structure that needs more mineral. So even for our team members, and I think one of the things that really changed their mind or their life or maybe their thought process is, oh, how is this applicable for my mom, for myself, for my family? So it has been very rewarding to see that switch of them seeing, hey, they're also health providers. So how do people follow you if they want to follow this journey that I know you just celebrate a year. Yes.
Yeah. Recently. Your brand new baby.
Yes.
With the vision starting from scratch. This is a California Dental Wellness Center. And where do they follow you? What social media handle would they follow and see the journey, both your practice and your professional account? So
for Instagram, it would be Dr. Ratna Indah. So Dr. Ratna Indah. And for the office, it would be at CA Dental Wellness, California Dental Wellness. Yeah. So I'm trying to document. I need to be better at it, but I do try to document the things that we do because there's a lot of things. No, it's like a lot, especially you are expanding and growing. So in order to share that on social, I know it's a lot of time to document, to share, also respond to all the DMs and the questions that people have during that journey. So I appreciate you taking the challenge to share this journey because I know how busy you are with family and kid and travel and lots of CE, lots of growing. And like I said to patient, if you want to find a good dentist, a good, especially biological wellness dentist, you're going to ask them, what have you learned lately? And if they said that was 10 years ago, then you run. But if they said, no, I just went to Beyond Biohacking, or I just went to the IBDM conference, or I just went like anything. Your wellness summit on December is always very exciting. Thank you. And so they gotta have to keep up with the information, just how your iPhone updated every year. But if your dentist is not updating their knowledge, then that means they are not going to be able to help you with the best information and the best technology. So very even us, we update our protocol actually quarterly. With all the things that we learn, we start asking about, constipations and not just blood work, but now genetic, not just that, but mold testing. We're adding a lot of this question because we know patients are getting those done. Yeah.
from their functional doctor. And
Your understanding just deepen and deepen every year. Yeah.
Yep. So I really appreciate you document the journey, sharing the journey, and come and share your philosophy, because that's what people want to hear. Like why biological dentist and wellness dentist is different from the conventional dentist. It's not because we're doing weird things. It's because we're asking questions and keep learning and knowing that there's a deeper connection than just the mouth.
Yeah, definitely.
Yes. So make sure you follow Dr. Ratna Indah on both her account and her practice. And we want to bring her back because as she's growing, expanding, we have so much to share. And so thank you again to be on the show. And don't forget to subscribe, and see you at the next episode. Okay. Thank you for listening today. Wellness starts in your mouth and includes your entire life. When you understand that, the whole game changes. Come learn more at thewellnessdentist.com. We see you in the next episode. And remember, there is always a reason to smile.